have any disclaimers. I will proclaim the greatness of the Society of Medicine Society, and I'm proud to support it today. I am a pinch hitter, I believe, and so I had to assemble this talk rather hurriedly, but my interest in it goes much, much deeper than that. I am eventually going to settle on William Halstead, who is, I think, a fabulous figure. But this is a retrospective, and since students will be perhaps listening to this, I wanted to give them a much broader, possibly the broadest review. So I'm going to start fairly early, but stay with me. We'll eventually Halstead. We're going to start with Galen. Everyone knows Galen was a physician who had more influence in the history of medicine probably than any single individual. He came from the island of Pergamum, which is in present-day Turkey, I believe, and he was a physician who made his name by treating the wounds of gladiators. He became very, very prominent. He was also came from a wealthy family, had a lot of money, and he had a lot of scribes, and he wrote about everything he saw and ever did. And he left one of the hugest paper trails in history. There's only probably one other guy that exceeded him, and that's a bishop in northern Africa named they left something like maybe 3 to 5 million words in their lifetime. He eventually went to Rome, became physician to the emperor, Marcus Aurelius, and he was a very authoritative, he was very persistent kind of fellow, and became a supreme authority in his day, and he wrote that way. He dissected almost every animal on earth except the human. And all of this is recorded in his work, which became the text for medicine for centuries. He was an empiricist, basically, as was the Greek school of medicine from Hippocrates. His therapy mostly was taking care of wounds, but the Greeks did have a system of therapy called humorism. They believed that there were 4 basic humors, just like there were 4 basic elements. 4 basic humors were blood, black bile, and phlegm. And these things, in balance, is what made health. And when they got out of balance, they made disease. And the treatment of these things historically was to try to get these things balanced. And what they did was they bloodletted, they purged, they produced vomiting, they did blistering and all kinds of things like that. And it was to change all of this, which took centuries. And it actually, Galen's influence lasted perhaps 1,400 years. And it took a long time to get over it. Why? I mean, it's complex. You know, there was the fall of the Roman empires, there were Goths and Byzantines. Eventually it kind of settled down with when Charlemagne came along and started the monastic schools, which eventually evolved into universities. First universities came along in the beginning of the 13th century, and the most important one for my narrative today is the University of Padua. And 3 of what I'm calling here, I'm being a little presumptive when I say greatest books, I know, but they are for this story. The 4 greatest books eventually ended the Galenic influence on medicine. As I said, that took 1,400 years, and then maybe another 2.5 centuries until we started to have some other ideas about how to treat diseases beside this humoristic therapy. The first 2 books, one in the 16th century and one in the 17th century, I think has really ended Galen's influence. He was an empiricist, and if people had kept to that way, they could have refuted some of the mistakes that he made in his theoristic concepts. For instance, the circulation of the blood, which was kind of wild. I don't want to repeat it, but it was kind of wild, but it persisted for a long time. The first book came along in 1545. It's called the Giovanni Corpus Fabrica. We call it the Fabrica, by Andreas Vesalius. The second, the De Motu Cordis of William Harvey, and then in the 18th century, the De Sedibus of Giovanni Battista Morgagni, and then in the 19th century, the Cellular Pathology of Rudolph Virchow. Well, just a brief. It's fascinating. I mean, Vesalius was a physician. Came from a long line of physicians. He started dissecting when he was 10 years old. He went to the University of Louvain since he was from Belgium. He got the Galenic teaching, and then went to the University of Paris and got the same teaching all over. But he realized that it was kind of ancient and old, and he was a kind of an innovative kind of guy. So he went to what was then the greatest medical school. That was in Padua. And that's where they dissected things on their own, and they were dissecting human beings, human corpses. And he was such an excellent dissector that after a year they put him on the faculty, and he changed the whole way medicine was being taught. In the Galen schools, professors sat on a high bank. There was and talked and read from a Galenic text. Students sat there and listened and probably slept through most of it. But Vesalius was different. This is on the right here is the frontispiece from his book, the Fabrica, and you can see Vesalius is. Oops, sorry about that. You can see Vesalius is right here in the middle. And here he is right here, and here's the cadaver, and he's bringing all the students right around him. Here and see what I'm see that Galen is wrong. This is what the truth is. Do it yourself, and that's the way he changed the whole method of teaching. The only other people that were around medical schools were artists, because the church actually promoted this section of human beings, but they wanted it limited. They didn't think it was something that everybody ought to do. And they encouraged doctors, of course, and artists, because they wanted the artists, we want to use them to, of course, religious things. But anyway, an artist came by named Jan Stefan von Kalkar. He was actually from the same kind of part of the world as Vesalius. They were both in their early 20s. Von Kalkar was a student of Titian, who was one of the great masters of the High Renaissance over in Paris. Padua was not too, as you know, and the two of them then conspired to produce one of the greatest books, I think, in the history. Kalkar did the illustrations, and Vesalius did the sections. Vesalius became famous. He became the physician to the emperor. Charles V was the Holy Roman Emperor, richest guy in the world at the time. He hated it. He had to join a bunch of other Galen physicians. He tried to get out of it after a while. He eventually did get out of there because he always wanted to make a pilgrimage to the Holy Land. So he convinced the emperor. He went to the Holy Land, and on the way back, he was in a shipwreck on a beautiful Greek island in the Ionian Sea called Zakynthos. And he died there, and people have been looking for where he died ever since. Just recently, the Belgian and the Greek governments had a huge celebration. I wish I could have gone. Dedication to the memory of Vesalius. I don't have enough time, but I had to bring this in because you find such sometimes wonderful things on the internet. You all know Edith. You all know Edith Wharton. She's a wonderful, wonderful American novelist, probably one of the greatest. Many of her books have been made into movies, like Martin Scorsese's Age of Innocence. Recently, maybe you've seen that. But she wrote a poem, a maid called Vesalius and Zante. Zante is the Italian word for the Greek island. And she says, who's Vesalius? This Fallopius it is who dragged the gear down, who rent the veil the way into the secret formless of life. God, what a wonderful thing to say, you know what I mean? About a guy, Vesalius. Why she was interested in Vesalius, I have no idea. But I thought it was just a wonderful poem. I just couldn't resist. Forgive me for that. But okay, so then the next then the Galen influence was the De Motu Cordis of William Harvey. He was an Englishman, and like Galen, he was very dynamic, very, very brilliant. These guys knew Latin and Greek, and some of them even Hebrew when they were, teenagers. So they were brilliant guys. He came from a very rich family. They were merchants, but he wanted to go to medicine. So where did he go? Of course, he went to Padua. And when he was at Padua, he was interested in the circulation of the blood. He did many experiments, usually on cold-blooded animals, because the heart was so slow, and he could study it a lot better. He also did, according to the recommendations of Roger Bacon, who was one of the founders, I guess, of modern science, to do calculations. And according to Galen, the liver produced the blood, then was like a tide that went out to bathe the tissues and was used up. And he calculated that if that were so, you would need 500 pounds of blood a day to be produced by the liver. And so you figured that was another thing. But anyway, his book, De Motu Cordis, we have in our rare book collection. And Donna gave me the privilege of actually holding it in my own hand. It was a great thrill to do that. But anyway, he went back. Sorry about that. This thing here is a stemma. It's kind of a plaque, a commemorative plaque that was left in his honor at the University of Padua. In Padua, the classes were divided into nations. There was an English nation, a French nation, a German nation. There was even a Jewish nation, a Muslim nation, and each nation had its kind of star. And Harvey was the star of the English nation, and this commemorative plaque, this picture which I took at the University of Padua in 2001, was placed there in 1601 by William Harvey, and it's still there in the University of Padua. It's a great place to visit, I mean, if anybody wants to do it. But anyway, it's fantastic influence on the history of medicine. He went back, he became a celebrity in England. He was the physician to the king until, of course, the king lost his head. He hated the Puritans. He never practiced because of that. But his book lives on, and it's just a fabulous contribution to medicine. Okay, that's just about put Galen down. But people just went on purging and bloodletting and doing all the kinds of things they always did. There was no therapy, so there had to be something to displace that. And I said that didn't come about in a day. That took a couple of centuries. But the guy that really did it was Giovanni Battista Morgagni in the 18th century, which was, and he was a young man and came from a little town called Forlì, which is close to Bologna, where they had a big medical school. And he wanted to study medicine. And there was a guy in the town of Forlì who developed a peri-umbilical pain, which then went to the right lower quadrant, then produced the psoas sign, and then he got the lower quadrant mass, and then he got and then he went into total body system failure and died. And he recorded all this, and then he did the autopsy, and he realized that this was due to a specific process that occurred at a specific site in the body. He went to his professor, Antonio Valsalva. His name is Venison, but he went to, and they decided to repeat what Morgagni had done for this patient in appendicitis for every patient that they saw. So they kept meticulous case history, and they performed the autopsy, and they said, jaundice is a symptom. The disease is in the liver. They said it was. That's what they said. On the site of the disease, and they correlated it, of course, with the clinical thing. And he started. This is where clinical pathological correlation began. And thereafter, right up until my time, one of the most exciting courses I thought medical. And this is what these guys, this is what he did. His book, they said became the first international of the Bible for the time. Every language from Portuguese, from Swedish to where, I mean, it was fantastic. Well, we got to get on. Well, after the Napoleonic Wars, the French took up this clinical pathological correlation, and in the Charité in Paris, this man Jean-Nicolas Corvisart started what he called the clinical parlay. He would make rounds. He would have visitors from all over the country. They would review the history, and then they would go to the morgue and do the dissection and correlate just like Morgagni had done. And this was the way that he taught it and explained the disease. His clinics became very, very famous. The Charité was a hospital where people, in those days, people went to the hospital and died. They didn't go to the hospital to get treated. It was but it became a great teaching institution. And his successor was I also think one of the great men, René Hyacinthe Laennec. And Laennec he invented the stethoscope, and he did such wonderful clinical pathological study. And his book on the diagnosis of the diseases of the lung and the heart is a masterpiece. He died when he was 40 years old from tuberculosis. Great honor. And then in the 19th century, the fourth great book was written by Rudolph Virchow on cellular pathology. The cell, well, if we know diseases start in organs, but then the basic element of the organ is the cell, the Schleiden, the Schwann. And he took, everything had to be correlated with the microscopic appearances. And he defined a whole, his accomplishments in medically are so great, I don't want to go into them. But he was also the father of public health, because he realized he took care of people in the cholera epidemic in Silesia and showed that, it was due to the poor health conditions. He advocated clean air, clean water, and clean earth. And he became a very, 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 very powerful influence that way. He became so persistent about this that he became a member of the Reichstag, and he got into trouble with Bismarck, who was, hated democracy and it was very authoritative. But his contribution left medicine, a rich legacy. But he did something else. He made the German School of Medicine the center of the world. And all of our American heroes, which I'm going to talk about, all walked the walk. They all went to Germany, and they all studied there. Well, we're almost there. We're almost getting to Halstead. 200 events that take place before Halstead could ride the wave, this huge wave which history gave him. I think that's what's great, makes men great. Great men are ordinary men who live at times like this was America's Day, October 16, 1846. And many people think this was the greatest contribution in the history of American medicine, or greatest contribution of America to medicine. And I suppose, I mean, that may be true. I'm not going to argue with that. And this is an operation done under ether by Dr. Warren, and it changed the whole aspect of surgery and treatment of medicine. But it's a complicated story. I don't want to go into it, and it's ways. Horace Wells was a dentist. He went to a nitrous oxide party. Nitrous oxide was kind of like marijuana parties. They sniffed nitrous oxide. Funny, they did. Everybody kind of was amused. He saw one guy bump his knee so strongly and didn't wince. He thought, oh, gee, maybe I. He went to a friend of his, and they did that in 1845. Fiasco. The place, and it happened. His friend who arranged this was a guy named Thomas Morton. Thomas Morton was also a dentist, but his wife, his girlfriend, the girl he wanted to marry, his family, and this was in Boston. They take these things kind of seriously. Said, didn't want their daughter to marry a dentist. This was not unacceptable. So Morton decided to go to medical school. He went to Harvard Medical School, and he met Charles Jackson, his chemistry teacher, and Thomas Jackson introduced him to ether, and said, "Look, if you want to, extract, use ether." Tried this out, and he was so astounded by this that he did the first extraction. Went back to Dr. Warren and got him to perform a removal of a parotid tumor on a patient, a surgery that lasted over an hour. The patient didn't say a word, woke up, didn't say he felt anything, and Dr. Warren's famous words were, "This is no humbug," and it's getting a surgical anesthesia. This is Morton here. He was a scout. He wanted to capitalize on this as much as he could, and he wasn't always truthful. He wasn't always honest in his dealings, but he wasn't all bad either. But I'll tell a little bit about him. And this is, I just have to mention Crawford Long, because Crawford Long here was a practitioner in Georgia, a little rural thing, and he although University of Pennsylvania, my put that in, but he was down there in Georgia. He was doing all kinds of things under ether anesthesia. 1842, the first time was in March 1842. Well, when the ether day happened, and Morton said, "Oh boy, I'm rich on this," immediately tried to patent the ether. Now this was a common thing. He tried to patent it, but he tried to disguise it, because everybody knows ether. You take one sniff of it, you know it's ether. So he tried to disguise the smell. He didn't call it ethion. He got a patent for it. And of course, the people realized soon realized that he probably didn't deserve it. He lost the patent. He sued the government. He was in constant contention with Wells and Jackson. Wells got so depressed that Morton's success, he committed suicide. When Morton lost his patent, he spent his whole time pursuing politicians, congressmen, influential people, trying to get his patent back. Brahmins, the high society, in which part murdered and Webster was accused. It's a very complicated case. Was recently a beautiful review of this was done on the PBS special called Murder at Harvard. If you want the details, look. But at that trial, Morton presented dental evidence for the first time in history as evidence as to the identification. That was pretty good. But as I said, Morton running around one hot day in New York trying to get some influence. Black is claimed. It's over 100. And he died that way. And a few years later, Jackson went to his grave, and on his gravestone it said, "Here lies Morton, inventor of ether." And Jackson took one look at that and had an acute psychotic episode from which he never recovered. So, I mean, ether might have been one of the great discoveries in the history of American medicine, but it's not exactly this, the happiest story. Well, anyway, there's a movie about Morton. It's called The Great Movement. It's got some nice stars, and you can see a nice buxom girl here in the front. What it has to do with history is very little. So, I mean, but it's a nice little movie. It centers around, this is an apparatus that Morton invented to administer the ether. And in the movie, it gets broken at the last minute. But it's okay. Okay, then we're almost there. And next comes along Joseph Lister. Joseph Lister, I mean, really his contribution was the thing that had to happen, because even with even with good surgical anesthesia, infection was almost always accompanied by any operative intervention. Everybody got infected, and in war wounds, everybody died from their infection almost. Well, he was a Quaker. He was homeschooled. Well homeschooled. He spoke French and German, and his father was some kind of a businessman, but his father, as a hobby, had made lenses for microscopes, and one of the big problems was, you get these rainbow effects around the image, and he developed the lens, done away with chromatic aberration, and so Lister had a lot of experience with microscopes from an early age, which really did well with him. He wanted to go to medical school. Because he was Quaker, he couldn't get into the established medical schools in England. He had to go to University College London, which was for everybody else. His greatest contribution occurred in August of 1865. He had been working with carbolic, which had been proposed by a German named Morgagni, to reduce infection. And with his microscope, he had shown that lice were right, that probably organisms were the basis of the infection, and that the carbolic got rid of the organism, which would get rid of the infection. We had a young boy was run over by a cart and had a compound fracture of his leg, the bone sticking out. Now, in those days, the treatment was amputation because you had a chance to survive. You know, you had a 60% chance of survival if you got an amputation. If you didn't, and you got an infection, the mortality was 100%. Boy was only 11. He reduced the fracture, treated the wound with carbolic, and the boy went on to an immediate and great recovery. It was an astounding thing. He was so excited. He published it. He didn't get it, and then he continued doing this work, and then published again. He got response in England to the College of Surgeons or anyone else. In 1870, the Franco-Prussian War came along, and in that war, there were a lot of war wounds. And there were like 20,000 amputations done on both sides, German and French, and the mortality was like 50%, for that. And but when he published this paper, the Germans and the French were extremely interested. The English didn't seem to care, but they were extremely interested, and he went over there and showed them his technique. He was lionized in Germany and in France. He became almost a national hero there. He went back to England, and they finally said, oh, wow, maybe this guy's got something. And he went to, eventually ended up in London and became professor there. And the crowning achievement was in 1902. King Edward VII, he was the son of Queen Victoria. When she died, he became king. 2 days before the coronation, he gets acute appendicitis. He refuses treatment. He says, I got to go on with the coronation. He feels better for a while. He gets sick again. He gets better, he gets sick, and 2 days later, he's got a huge right lower quadrant mass and febrile, and they decided maybe they better call in a surgeon. So they called in a surgeon named Treves. Treves, you may know, he's the guy who took care of the Elephant Man. But he was a good surgeon. And he recommended surgery, and the king said, no, I'm going to the coronation. And Treves said, Your Majesty, you're going as a corpse. And so I guess I got the king's attention because he agreed to the operation. They called in Lister, and Lister said, so they followed Lister's instructions exactly as to how to treat, how to prevent infection. The king made a very quick and speedy recovery. So that was the great moment when he died in 1912. There was a memorial service almost in every medical society in the world. So he became very famous. And now we're getting to where we want to be. All of this had a profound effect, especially the Lister eventually on Halstead. Halstead came from a very well-to-do New York family, born in, you see, 1852. This is his, oops, sorry again, I keep doing that. This is his picture when he graduated Yale in 1874. He was a very extroverted guy. He was a big man on campus, captain of the football team, a lot of partying, not much studying. But he did graduate. But in his last year, he got introduced to a dissection, and he became so fascinated with that when he finished, he decided to go into medicine. So he matriculated at the College of Physicians and Surgeons, which is now Columbia University, but then it was a proprietary school, as we say. But he went there, he graduated, and when he graduated, he wanted to take an internship at Bellevue. It was a very competitive examination. Everybody took it. He won. He got the internship. He went to Bellevue and became the intern. As I said, this is him when he was young, extroverted, dynamic, outgoing kind of guy. And this is Halsted later. But in between, there was a tremendous personality change. This guy was reclusive, uncommunicative, very focused, very hardworking, but had no other interest in life except medicine. Didn't talk with people. he did have a very nice wife, but they lived a very, never had any children. He lived in one part of the house, she lived in the other part of the house. They said hello occasionally. I guess they did all right otherwise. Well, when he finished his internship, he walked the walk. He went to Germany and he spent 2 years there. Visited every medical facility in Germany for 2 years, and he came back, and he was extremely dynamic, extremely busy. He was on the staff of every hospital in New York City. He ran around from one hospital to another. At Bellevue Hospital, he heard Lister speak, and he adhered to his recommendations completely. It was very hard to do. He had to have carbolic and special things and drapes and smelly, and nobody wanted to do it. He actually set up a tent hospital on the grounds of Bellevue Hospital, which was just his very own operating room. And that's where, so he could apply Lister's technique. And his results were so much better that he started to get a huge reputation in the city of New York. He was an amazing guy. His sister, after childbirth, had a hemorrhage, and she was actually pretty much bled out and was going to die. He actually gave her a blood transfusion, using himself as a donor. Was probably the first transfusion in the United States, saved her life. His mother had acute empyema of the gallbladder, and was dying from sepsis. He operated on her at home in her bed, drained her abscess. I mean, this is the kind of a dynamic guy he was. But to see him later on, he was a totally different kind of guy. And what did it? What is the thing that changed him? It was cocaine. He became addicted to cocaine. And that's one of the most fascinating stories in the history of medicine, because it happened in around 1884. And I mention that because there's a recent book published that's very fascinating by a guy named Howard Markle, who's professor of psychiatrist, professor of psychiatry, and of the history of medicine at the University of Michigan, who's written a book called Anatomy of Addiction. Freud and Halstead. They never met, they never knew each other, but they both became addicted at the same time, and around the same time in 1884. Basically because of a discovery of a paper that was written, which we'll get to in a minute. Howard Markle notes that a patient came into the hospital one day with a compound fracture, just like Lister had seen. And Halstead was the guy to treat him. He was called, but by this time he was pretty addicted to cocaine. He got the patient, walked in the operating room, and apparently the effects of cocaine hit him like it never hit him before. He just, to everyone's amazement, he turned around, walked out of the hospital, and went home and was in kind of a stupor for almost a year. At the end of that, he realized he was so bad. He was admitted to what they called in those days an insane asylum in Rhode Island to try to recover. They treated him by giving him morphine to getting him off the cocaine, so that when he left there, he was addicted to both cocaine and morphine. And yet, when he came out, he couldn't practice. His personality was totally changed. But he still continued his work. He went in the laboratory and showed how the best way to put two pieces of bowel together. He said you have to use the submucosa, and he showed the technique to do it. He worked out the anatomy for the repair of inguinal hernia. He set the basis for radical mastectomy for the treatment of women. And there were a lot of women who waited till the last minute. They had large infected fungating breasts. He did the radical mastectomy. He did And this the whole time he's struggling with this terrible addiction. Markle states that Freud, he talks about Freud too and how it affected Freud. It changed his personality. Freud at first loved it. He thought, oh, this is the greatest treatment for depression I've ever seen. It made him very energetic, very outgoing, very talkative. And there's been I read a tremendous exchange of letters of a guy that criticized Markle's books and his handling of Freud, because Markle suggests that Freud probably cold turkeyed and never went back to cocaine. But there's a professor out of Berkeley named Frederick Cruz, who has written a book countermanding Markle, and said that probably the whole theory of psychoanalysis and everything else that Freud did was maybe based on cocaine illusions. But I don't want to go there. I don't want to discuss so. But anyway, in 18, I said, and then here it says, I'm sorry, 1886, but it's 1888, Johns Hopkins University was formed, and four great physicians were called there, one of which was, well, three at the time, and one potential who became a great physician. That was Halstead. The four doctors that you know. He'd done this work despite all this, and he didn't have any more of those acute psychotic breakdowns. That one of the doctors, William Welsh, invited Halstead to come to Hopkins, and he did. He went to Hopkins, and he was on probation. The others were all seated as full professors, but by 1990 he was made chief of surgery, and he had despite all his medical contributions, one of which was rubber gloves. He did that he fell in love with a nurse and married her, but she kept working in all these antiseptics. Her hands were so raw, he invented rubber gloves. They were also good protective against infection. But anyway, what he did was change the whole business of medical education by creating the residency program. It's an outstanding contribution, and one that for which we still respect for the day. The other thing that he did was to show that you could take a substance like cocaine and inject it into a nerve and block the sensory nerve and block the pain impulses. And because of that, of course, and by the early 1900s, everybody realized how bad cocaine was. Nobody wanted to inject it into a nerve. But Halstead, in conjunction by talking to a German, he always kept in contact with Germany all his life. With Germany, German chemists came up with a new cane, not cocaine, but a new cane he called Novocaine in 1905, and that made dentistry a clinical specialty. That's what it is, and that's what did it. And all that was Halstead, an amazing kind of guy. He got a gold medal from the American Dental Association right before he died, from the American Dental Association right before he died. Well, this was the guy that caused the event, that caused the addiction of Freud and Halstead. His name was Karl Koller. He was an ophthalmologist in Vienna. He was a Czech by birth. He was an ophthalmologist, and he showed that that topical administration of cocaine made the eye incentive, and you could do things to the eye that you could never do before. The paper was presented at the Ophthalmological Society in Heidelberg in 1884, and one of Halstead's colleagues was there, and I came back and reported it to Halstead, and that's what made Halstead start to experiment with cocaine. Freud also was an acquaintance of Koller, and he also started. He knew about the anesthetic properties, but he totally ignored it. He was well interested in everything else. Freud actually became pretty severely addicted. As a matter of fact, he got such a nasal congestion from the cocaine, he had to have an emergency operation so that he could breathe. And yeah, I think I find it hard to believe, as Markle suggests, that he became totally abstinent by his own will. Halstead was never, he was thought to be free of substance abuse, but he never was. When he died in 22, it was evident that he was on morphine. But by tremendous willpower, he never let it interfere, to the point where he couldn't do his work. And I think that's amazing. And ironically, neither one of them died from it. Although many of their friends, Halstead had given it to his colleagues and his friends. All of his lives were ruined. Their lives were ruined. But somehow neither one of those guys died. Halstead died ironically, after a gallbladder operation, which he helped create. And I guess Freud died from cancer of the mouth from his cigar smoking habit. But Koller eventually came to New York. There was a big contingent of German surgeons in New York, German medical people, and he became a very prominent ophthalmologist. He never wanted to be associated with cocaine, wouldn't give any talks, wouldn't mention it. Maybe because he was given the nickname Coca-Cola in America. By the way, a soft drink came out at that time called Coca-Cola, and it's supposed to have had coca in it, and cola nuts, extract from cola nuts. Well, by that time, it got so bad that the Coca-Cola company had to do everything it can to get the coca out of whatever. I don't know how much they had, but it became a very serious problem. The psychiatrists or psychologists were giving it for nervousness, for hysteria in women, and at the beginning of the century, and in Iowa, the records show that 75% of the addicts in Iowa were women who were given cocaine for hysteria to make them. So that was a serious kind of thing. Okay, well, these are the four. That's when it went. This was the painting, and this is Halstead. He was in the background. He was not really in yet. Okay, and this was commissioned. I have this lady's picture up here because she's the lady who paid for the painting, and the women had a tremendous influence. The Hopkins Hospital came about by a grant. I'm going on too long here, but is it okay, you guys? He got a grant from Johns Hopkins, and they had enough to start the medical school. But these guys, especially Halstead, he wanted pharmacologists and chemists, and he wanted them to have their departments, and he wanted them to have their laboratories. They needed more money. And where did they get the money? Well, the ladies, the wives of these, they were all prominent people. They all knew bank and a lot of people. So the ladies came forth and said, look, we'll get the money for you. We want two things. One, we want women admitted, and two, we want criteria for admission. We don't want you to admit high school students or high school. We about having college graduates with an aim for medicine. Well, Halstead immediately said, fine. The other guys kind of hesitated, drug their feet. Took several years, but eventually they gave in. The women raised the money, and in 1893, the first medical students were admitted to Johns Hopkins. So you got to give a little credit to the ladies here. We're always glad to do that. Okay, well, what was the effect in Iowa? Well, the American Medical Association, the Committee on Medical Education of the American Medical Association commissioned the Carnegie Foundation to do a study. And the Carnegie Foundation reported what everybody knew. It was abysmal. There were all these proprietary schools. Chicago had 14 schools. There were schools almost in every little town in Iowa. There were part-time faculty. The students were kind of indentured. The teaching was at a minimal. And so they said, we got to do something about this. So they appointed a guy named Abraham Flexner, who went around to every medical school and usually nixed them all. I don't know where he got his authority, but I guess if you say something authoritatively in those days that people took it seriously, many of the medical schools closed. A lot of them closed. When he got to Iowa, the most prominent one was in Keokuk. He recommended that it be closed. Well, Iowa had been making some efforts before that. In 1870, they actually, the state legislature formed a medical department, which was some kind of function as a university hospital. And that medical department became a founding member of the American Association for Medical Colleges. And just before the Flexner report, they had actually made an appropriation to build a medical school in Iowa, which was built. It's now what we call Seashore Hall, down here in the center of town, had 65 beds. And 65 beds, it wasn't bad, it was a start, but it wasn't enough to satisfy Flexner. Flexner's report came out in 1910, okay? And as a result of that, the Keokuk school closed, merged with the University of Iowa, but that wasn't enough either. Flexner was then given a lot of money by the Rockefeller Foundation to back the schools that he recommended, make the change after the Hopkins model. Hopkins was the model for which all schools were supposed to be patterned. And Iowa took this seriously, apparently, because when Flexner came back to Iowa in 1924, he thought Iowa was perfectly ready for this, that he gave the first appropriation of Rockefeller money went to Iowa to build a medical school that was started in 1925. Okay, we went from this, we went to this, to this. And so that's another effect of Halstead.